Hello and welcome. Today we'll be discussing bladder ulceration, a condition that can cause significant discomfort and impact the quality of life. We'll delve into the causes, how it develops, the signs and symptoms, diagnosis, treatment options, and more. So, let's begin our journey into understanding bladder ulceration. The causes of bladder ulceration are diverse and often complex. Several factors can contribute to its development. Chronic inflammation due to conditions like interstitial cystitis or recurrent urinary tract infections is a primary suspect. Trauma to the bladder, perhaps from catheterization or surgery, can also damage the bladder lining. Radiation therapy to the pelvic area, often used in cancer treatment, can injure bladder tissues leading to ulceration. Chemical irritants, whether ingested or directly introduced into the bladder, can erode the bladder's protective layer. In some instances, certain medications or underlying medical conditions can increase the risk. Identifying the specific cause in each patient is crucial for effective management. The pathophysiology of bladder ulceration involves a breakdown of the bladder's protective lining, the urothelium. This lining normally acts as a barrier against irritants and bacteria in urine. When this barrier is compromised, the underlying tissues become exposed and vulnerable. Inflammatory processes are then triggered, leading to further tissue damage and ulcer formation. Nerve endings in the exposed areas become hypersensitive, contributing to pain and urgency. The ulcerated areas can also bleed, resulting in hematuria or blood in the urine. Over time, the ulcerations may lead to scarring and bladder dysfunction, impacting its capacity and ability to empty properly. Essentially, it's a vicious cycle of damage, inflammation, and impaired healing. Determining the precise epidemiology of bladder ulceration is challenging, as it often overlaps with other bladder conditions, particularly interstitial cystitis. It's difficult to isolate the cases directly caused by ulceration alone. However, we know that it's more prevalent in individuals with chronic bladder inflammation, those who have undergone pelvic radiation therapy, or those with a history of bladder trauma or surgery. Women appear to be more susceptible than men, likely due to anatomical differences and a higher risk of urinary tract infections. Further research is needed to fully understand the true prevalence and risk factors associated with bladder ulceration. The signs and symptoms of bladder ulceration can vary in severity but often include persistent pelvic pain, which may worsen with bladder filling. Urinary frequency and urgency, meaning a need to urinate often and immediately, are common. Painful urination, known as dysuria, is another frequent symptom. Hematuria or blood in the urine may also be present. Some individuals may experience pain during sexual intercourse. It's important to note that these symptoms can also be indicative of other urinary conditions, so a thorough evaluation is necessary for accurate diagnosis. Diagnosing bladder ulceration typically involves a combination of clinical evaluation and diagnostic tests. A detailed medical history and physical examination are essential. Urine analysis can help detect the presence of blood or infection. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, allows direct visualization of the bladder lining and any ulcerations. Biopsies or tissue samples may be taken during cystoscopy to rule out other conditions, such as bladder cancer. Imaging studies such as CT scans or MRIs may be used to assess the overall health of the urinary tract and rule out other potential causes of symptoms. While bladder ulceration doesn't have distinct formal classifications like some other diseases, it's helpful to consider the underlying causes and the severity of the ulcerations. For example, ulcerations caused by radiation therapy might be categorized differently from those caused by chronic infection. The size, depth, and number of ulcers can also influence treatment decisions. Understanding the specific characteristics of the ulceration in each individual helps guide a personalized management approach. Treatment and management of bladder ulceration aim to relieve symptoms, promote healing, and prevent complications. Pain management is often a priority, utilizing medications like analgesics, anti-inflammatory drugs, or bladder anesthetics. Bladder instillations, where medications are directly instilled into the bladder, can provide localized relief and promote healing. These installations may contain substances like hyaluronic acid or chondroitin sulfate, which help to rebuild the bladder lining. In some cases, surgery may be necessary to repair severe ulcerations or remove damaged tissue. Addressing the underlying cause, such as treating an infection or managing interstitial cystitis, is also crucial for long-term management. While preventing bladder ulceration entirely may not always be possible, several strategies can help reduce the risk. Practicing good hygiene to prevent urinary tract infections is essential. Avoiding known bladder irritants, such as caffeine, alcohol, and acidic foods, may help some individuals. Staying well hydrated is important for maintaining overall bladder health. If undergoing radiation therapy to the pelvic area, discussing potential bladder protection strategies with your doctor is crucial. For those with chronic bladder conditions, consistent adherence to prescribed treatments can help prevent further damage. The prognosis for bladder ulceration varies depending on the underlying cause, the severity of the ulcerations, and the individual's response to treatment. With appropriate management, many individuals experience significant symptom relief and improved quality of life. However, chronic or severe cases may require ongoing treatment and management. Recent research is exploring new bladder installation therapies and novel approaches to promote bladder lining regeneration. There's also growing interest in understanding the role of the microbiome in bladder health and potential therapeutic targets. Ongoing research holds promise for improved outcomes in the future. Thank you for joining us today in learning about bladder ulceration.